You're always wondering in the back of your mind if someone that you're taking care of potentially has COVID and is asymptomatic, or vice versa.
This nurse, who works at the Foothills Hospital here in Calgary, is sharing what it's like to work in a building with a growing COVID-19 outbreak. City News has agreed to keep her identity anonymous.
It feels really, really real, I think, and people are afraid. They're afraid for their families and their friends.
As of Sunday, 5 more patients and 7 more staff contracted the virus in relation to the outbreak, with 25 patients and 25 staff cases since it began. 4 people have died due to COVID-19, and there are now 2 more units under an outbreak, with 3 more under a watch. One of those units is not believed to be connected to the outbreak, according to AHS. 136 staff are isolating as of Sunday.
Tension's really, really, really high. Kind of as soon as the outbreaks were announced, the morale in the hospital kind of dropped almost instantly.
She says the number of staff self-isolating hasn't affected her work schedule, though other protocols implemented because of the outbreak do concern her.
I don't really want to elaborate on it just because it's kind of a specific policy that impacted kind of one of our life-saving measures, and it was a hard situation for, I think, anybody who had to go through those types of experiences during COVID, because policy definitely impacted how we responded.
Visitation is still allowed in the hospital aside from the units under outbreak, though she says as the situation evolves, she could see that changing. The Foothills Hospital outbreak is the second deadliest to hit an Alberta healthcare facility since the start of the pandemic. As restrictions in Alberta continue to lift and life seems to be getting closer to what it once was, the nurse says the situation at the Foothills Hospital is a reminder for her that the pandemic is ever-changing and far from over.
This definitely has been shocking, and it just shows kind of how, in the right number of circumstances, that COVID can spread so quickly to vulnerable people, and it's definitely an eye-opener.
In Calgary, Taylor Braat, City News.